Hey guys, I'm here to help answer the question, what is physical therapy, or who are physical therapists? Um, I'm surprised all the time by people asking what we can do and how we can help. Or maybe I'm talking to someone about a condition and they look at me and say, "You can help me with that?" I'm like, "Yes, we can help you with that." So I just kind of Googled like who are physical therapists, and the first thing that pops up is the definition. Physical therapists are movement experts who optimize quality of life through prescribed exercise, hands-on, and patient education. So we don't prescribe medicine; we prescribe exercise to help you feel better. So let's dive into that just a little bit more on exactly like what all that means, right? So prescribing exercise could be to help get you better by increasing strength or increasing flexibility and range of motion. And so we will come up with the correct exercise to help get you better by getting more range of motion, more strength, which sometimes helps with pain in most cases. So that's kind of the first step of what we do. We look at the movement pattern of someone who has pain. And sometimes it's pretty obvious. You see a limp, somebody hurting, and they're going to be limping around. But why did they get hurt? Is always the question I want to ask. And sometimes it's traumatic, and we can't prevent those things. We just can help rehab a traumatic episode. But sometimes there's really not a mechanism of injury. There's just what we call like a insidious onset. Something just kind of came out of nowhere and started hurting. You woke up one morning and you started hurting. And so we kind of dive into those things, and that's where the critical thinking comes into play with physical therapists. We can start to look at exactly why you're hurting and what got you there. Okay, so we will say, you'll hear us say cause of the cause. What's the cause of the cause? And that's a lot of our job right there, is just trying to figure out what things are you doing throughout the day that's causing your joints to not move properly, and your muscles, and like why is this muscle strong, why is this muscle weak, and what led to that inflammation. So the itises and the osises and the tendinopathies that you talk and hear about, we can definitely help with those things. And how do we help with that? It is trying to figure out how you got there.